The diaphragm normally has a small opening, the hiatus, that allows the food to go through the esophagus on its way to connect to the stomach. Hiatal hernias occur when the muscle tissue surrounding the opening becomes weak and the upper part of the stomach bulges through the diaphragm into the chest cavity. So literally, it's a protrusion of a portion of the stomach through the diaphragm into the thoracic cavity. A sliding hernia is in which the stomach and the gastroesophageal junction slide up into the chest, which is the most common. Paraesophageal hernia is called a rolling hernia, and part of the curvature of the stomach rolls through the diaphragmatic defect. Clinical symptoms would be pyrosis with or without regurgitation of gastric contents into the mouth and chest pain. The sliding hiatal hernia is the most common. The problem with the paraesophageal hernia is that it can become strangled, which means that its blood supply is cut off. Barium swallow or upper GI series may be performed in which the patient drinks contrast material and x-rays are taken. The barium study of the esophagus outlines the hernia. An endoscopic examination can visualize the defect. The cause is unknown, but hiatal hernias may be the result of weakening of the supporting tissue. Increasing age, obesity, and smoking are known factors in adults. Hiatal hernias are very common, especially in people over 50 years of age. To manage this, it needs to be elevation of the bed to reduce nighttime reflux, antacid therapy to neutralize gastric acid, H2 receptor antagonists if the patient has esophagitis. Surgical repair of symptoms, if it's severe, then a Nissen fundoplication could be done, but remember that a complication of a Nissen fundoplication could be a pneumothorax. Hiatal hernia complications: aspiration of the reflex contents, ulceration, hemorrhage, gastritis, stricture, strangulated hernia. The blood supply is cut off to the trap portion of the stomach, causing great pain. This is a true medical emergency. Some medications effectively reduce secretion of stomach acid, while others increase the muscle strength of the lower esophagus, thereby reducing acid reflux. Over-the-counter medications for longer than 2 weeks without any improvement may need to get a stronger medication, like a proton pump inhibitor. If medications are not effective in treating the symptoms, the diagnostic test may be done to determine if surgery is necessary. Nursing management is to assess for chest pain or pressure, heartburn, difficulty swallowing, coughing, belching, hiccups, eructate. Most hiatal hernias do not cause problems, and the patient may never know they have a hiatal hernia until it is discovered during an assessment. That's usually when they hear some tinkling in the chest. Lifestyle changes are often necessary to avoid symptoms of a hiatal hernia. Patient teaching includes prevention of reflexive contents by eating smaller meals and avoiding smoking, caffeine, and alcohol. Patients should refrain from lying down for at least 1 hour after meals. They need to lose weight if they are obese. They need to quit smoking and avoid bending from the waist or wearing tight-fitting clothes.